Good day, I am Rizakiel Mhadyzon Cantillo, and for today, I'm going to perform the female catheterization. But prior to that, let me first show you my place or my surroundings so that you won't suspect me for any kind of cheating such as reading. Here, it is the front view. This is where I will perform my return demonstration. I will position there. Then, that is the background of the, if I will take a video, this is the background. And next, the back view. So how can I say that it is the back view? Because of this. This is where I will put my cell phone whenever I start my return demonstration. And it is the, or this is what it looks like. So as you can see, there is nothing posted here. So there is no chance that I will cheat or I will read anything. So here, let me turn around. Okay. Back, or I mean downwards. Alright. So as you can notice, I have here a extra phone. Or if you're wondering why I have here an extra phone, I will use this as my second camera because I want my return demonstration to have a focus on the procedure as well as emphasizing the equipments that I will be needing or I will be using. So that's all. So now that you've already seen my place or my surrounding, well, it's not really mine because I'm just using the room of my relative because our house is not that spacious. Well, anyway, let me now begin on my return demonstration. Again, good day. I am Rizakiel Mhadyzon Cantillo, and for today, I'm going to perform the female catheterization. So for this procedure, we need first to assess the client's need for catheterization. We need to review the medical record, any medical or pathological condition that may impair the passage of the catheter. And also, we have to be aware for any record of allergies of the patient because it will affect the catheter insertion. And then we also need to know the age and gender of the client, and we have also to verify the doctor's order so that we will know if we're doing the right procedure to the patient. Then the indication for the indwelling catheter, just like what I have mentioned a while ago, the indwelling catheter is what we will be using right now. So the indications are: first, monitor urine output; second, the relief of urine retention; third is the immobilized or incontinent patient; and lastly, the intraoperative patient. So after that, we need now, or we will proceeding on preparing the equipments that we will be using. So for this procedure, we'll be using a fenestrated drape, of course, the indwelling catheter, the sterile syringe with saline, lubricate or lubrication, betadine together with cotton applicators, the sterile gloves, of course the collection system, the drainage bag. So all of these are sterile. So aside from these sterile equipments, we'll also be needing a clean gloves, so that for the preparation for the catheterization. Okay, so after preparing all of this, we need to wash your hands and observe other infection control procedure. The rationale is to prevent the spreading of microorganisms. Next is to greet the patient and introduce ourselves. Also explain plan and procedure to her or why it is necessary. So the rationale is for us to verify if we're handling the right patient and for the patient to be aware what we will be going to do. So the rationale for doing the female catheterization or the catheterization is to drain the urine from the bladder, or it is mostly used or it is mostly applied on the patients who will undergo in surgical procedure, or those who are patients who are not able to eliminate by themselves. Okay, so after that, we need also to provide privacy to the patient while doing the whole procedure, especially now because we're exposing their genitals. So it is also, or it is really important to provide privacy in order for her to be comfortable while doing the procedure. So after doing all of that, we need now to proceed on the implementation proper. We need to position our patient in supine position with knees slightly flexed, about it should be in 2 feet apart, and of course the hips should be externally rotated. And the rationale for doing that kind of position is that we can easily access the vagina and we can easily insert the catheter in doing that position. Okay, next is we need to raise the bed in appropriate working height so that we cannot be hassle in doing the procedure, so that it can be raised on the appropriate working height. Next is we need to stand on the client's right side if we are right-handed, and vice versa. We need to position ourselves in the right side of the client, left side of the client if we are left-handed. So I am right-handed, that's why I am here at the right side of the patient. So we will now proceed on opening the catheterization kit. So for this, we need to wear a clean gloves. So there are a lot of gloves, but for this time we have to wear a clean one. Okay. Alright, so after we wear the clean gloves, we'll now place the drip or waterproof drip under the buttocks of the patient, and make it sure that we will not contaminate the center of the drip, because this is where we will put, or this is where it exposes the labia. Alright, so after that, we need to assess the fullness of the bladder, of the patient's bladder. In doing that, we need to palpate the bladder over the symphysis pubis. Alright. So after that, we need to remove our clean gloves. Next, after doing this, we need to place in one place all of the materials that are discarded, because they should not be together with the sterile materials, because it will be contaminated. So it should place only in one place. Next is we need to wear our sterile gloves. Alright, so here our sterile gloves. So since our space is not spacious, we need here. But we have to make sure to maintain, or we have to maintain the sterility. Alright. Next. Okay. So as what I have mentioned, we have to place it on one place. Okay, so now we already had our sterile gloves inserted on our hands. We need now to pre-connect the indwelling catheter to the drainage package or the collection system. The next is we need to expose the labia, and in doing that, we need to place our non-dominant hand on the labia of the patient, and then exposing it using the thumb and the index finger. We need to expose the meatus. Alright? So, after doing that, we need now to get the betadine and the applicator, or betadine, applicator with betadine, and then wipe it gently but firmly to the meatus so that we will be able to clean before the insertion. Okay, so 1, 2, 3. Alright. So, after doing that, or after cleaning the labia or the meatus, we need now to pick off the indwelling catheter and then lubricate it for about 2 to 5 centimeters, or approximately 1 to 2 inches. So, now, we will now insert the indwelling catheter to the patient. So, before inserting, we have to inform and instruct the client that we will be inserting now the catheter. So, ma'am, I will be inserting now the catheter. Alright, so gently insert it to the urethra. Alright, until there is a urine flow. Okay, so let's observe if there is a urine flow. Alright, so once that the urine drains, let us advance the catheter for 5 centimeters, or approximately 2 inches. Alright, so, okay. The rationale for doing that is for not putting extra pressure on the bladder. Right. So, after that, we need to hold the catheter using our non-dominant hand so that it will stay in place. And then inflate the retention balloon with its designated volume. Alright. So, after that, we need to check if the balloon is now anchored by pulling it gently. Right. So, if we notice the resistance, okay, so it is now anchored correctly. So, after that, we have to check the urine flow, if it's flowing correctly, and also the discomfort of the patient, so that we can do some adjustments in order for her to be comfortable. And now we will need to secure the catheter to using a non-allergenic tape to the thigh of the patient. So, here, so let's assume that this is the thigh and we've already placed a tape here, and using a non-allergenic, so that the rationale is for the patient to prevent any allergies causing to that tape, and also for the catheter to stay in place, because it has a tendency that it will be moved because of the patient, so that we will need to secure. And also the drainage bag, we need to hang it on the side. Alright. Okay, so after doing that, we need to clean the perineal area with a clean wipes or towel, or we need to clean the excess lubricant that we already used for the client, and also we need to remove the drape. Okay, so remove the drape, all of the drape. Alright, so now we've already removed all of the materials, or the drapes rather, and position the client where she is comfortable. And after that, we need to remove our gloves. Alright, so we need to gloves and dispose all of the materials that we've already used, and then we have to do the proper hand washing so that we will prevent the spreading of microorganisms, and then document all of the data that we gathered or the procedure and also the findings. Thank you.